I'm going to be discussing with you today the results of two studies I did using a compound called ethicin, which showed that elastic fibers in skin are increased with its use. We all know the clinical signs of intrinsic aging of the skin, that the skin thins, it gets rougher, it loses elastic tissue and elasticity as people get older. Also, there is pigmentary alteration and hyperproliferative lesions such as seborrheic keratoses develop. The histological changes of intrinsic aging of skin reflect that as well. We get dermal thinning, we get decreased cellularity of all levels, there's decreased vascularity, there's a decrease in elastin fibers, there's increased collagen cross-linkage, and the skin therefore loses its resiliency and it becomes lax. The effects of ethicin had been found in tissue culture to show that when it was incubated with human fibroblasts, the elastic tissue production was increased. The mechanism by which it works is it's a competitive inhibitor for DHT, or dihydrotestosterone, on the receptors of the fibroblasts. Ethicin is rapidly metabolized in skin to an inactive form, and therefore no systemic effects occur, since no active drug is absorbed into the plasma. It's fortunately non-toxic to animals in large doses. The purpose of the first study that I did was to determine whether the application of ethicin to aging skin would increase elastic tissue production. The study was of an open label form. The study medication was ethicin 5% in an alcohol and water vehicle, 75% ethanol and 25% water. It was applied twice daily to both facial skin and forearm skin. The subjects were 20 Caucasian males and females, aged 40 or more, all of whom had signs of aging of the skin. There were actually 17 females and 3 males in that first study. The duration of the study was 6 months. The data that we collected is we biopsied the forearm since we thought patients would be a bit reluctant to take facial biopsies. And we did these biopsies at baseline, 2, 4, and 6 months. They were then stained for elastic tissue, and they were photographed with a fiber optic video camera and stored on computer. That enabled us to use a computer later on for image analysis of those slides to tell us what the percentage of elastic tissue taking up the stain was on each slide. We also took close-up clinical photos which were randomized and evaluated by a panel for changes. The patients were also asked what they had noticed during the study, and those of us conducting the study also made careful observations of any changes that were occurring during the study. On this study, the percentage of elastin that was found on computer image analysis was at baseline 9.2%. By 2 months, it had increased to 13.3%, virtually a 50% increase. At 4 months, it had virtually doubled to 18.2%. And at 6 months, it had leveled off at 14.7%. There was a p-value of less than 0.001 for the changes at each interval. We did extensive safety profiles. We did extensive blood work, including CBCs, hemoglobin, hematocrit, platelet levels. Serum chemistries were done in detail, as well as hormonal screens and urinalysis. And throughout the study, there were no significant changes on any patient whatsoever. In summary of what we'd found on that first slide, the overall group on the average with this assay system showed about an 8% or 8.5% level of elastic tissue. It increased greatly by the 2-month period to about 14%, was 20% by 4 months, and at the 6-month evaluation had leveled off at a little over 15%. If we only look at those individuals who'd started out with a fairly low level, the lowest being 0.1%, their overall average at baseline was just over 5%. And looking at that group, the increases paralleled what we found in the overall group. If we looked at those who were in the range from 0 to 15%, again we found that the changes at 2, 4, and 6 months paralleled what we found overall, even though they'd started at a fairly low baseline. If we knocked out those individuals who had started out with very low levels or very high levels, again we find a graph showing pretty much similar levels with increases to about 15% at 2 months, a peak at over 20% at 4 months, and a return to a level a bit over 15% at 6 months. What that tells us is that whatever level the subject started at, we're able to generate higher elastic tissue levels to about 15% leveling off, with a peak at about 4 months. In summary then, that first study used ethicin 5% in an ethanol and water vehicle. We showed the safety of ethicin. We showed increases of elastic tissue at 2, 4, and 6 months with a p-value less than 0.001, which is highly significant. The patients reported smoother, tighter, less wrinkled skin. However, on the clinical evaluations, we were able to document, as we knew, that the alcohol and water vehicle was drying, and that somewhat made it difficult to show clinical improvement on the slides that were meant to assess that. From the first study, we came up with several hypotheses. Since DHT is being blocked, it must be suppressing elastic tissue production in aging skin. Since the ethicin increases its production, and since what ethicin does is bind to that receptor site, the mechanism of its action must be as a competitive inhibitor for that receptor site. The production of elastic tissue clearly peaked at about 4 months with this study and then leveled off. There must be some adaptive mechanism on the part of cells to that receptor blockage so that the elastin production would not be excessive and go on unchecked. We would also hypothesize that since DHT is present in younger individuals' skin, that if we applied ethicin to the skin of younger individuals, their elastin production would not change appreciably. That left several questions to address. For example, what is the percentage of elastic tissue stain that would be shown within this assay system using computer image analysis in younger individuals? How quickly does the ethicin work, since we found clear changes at the first checkpoint, which was 2 months, and patients were telling us that they could tell differences on their skin in many cases within the first month. We wanted to look at an earlier checkpoint. Also, we'd used a fairly high concentration, certainly enough to block all of the receptor sites, and we would like to know what the optimum concentration was, potentially a lower one than the 5% one. Also, we knew that the drying effects of the alcohol and water vehicle would not provide the optimum vehicle, and we wanted to see if we could find a better one. Therefore, a second ethicin study for its effect on elastic tissue was designed. This one was to be a 3-month study, and biopsies were to be taken at monthly intervals, baseline 1, 2, and 3 months. The vehicle used was a liquid one, predominantly propylene glycol, ethicin essence, at 0.5% concentration, followed by the application of an ethicin in concentration 0.01% in a moisturizing base. This study used 29 subjects aged 40 to 77. Also, we used a control group of people between 18 and 25 with 18 individuals in that group. That would let us see whether the levels we were reaching were the levels that were found in youth. Now, going through the individual slides, using the Verhoff stain, we show that the black material is the elastic tissue levels. We actually used 3 pictures, one from each section on each slide, and took an average percent, and these slides just show a representative before and after of each case. The first patient was a 47-year-old male who started out with fairly low levels of 6.9%, was up to 13.6 by 2 months, and clearly an increase. 42-year-old woman going from 3.3% to 16.7% by 2 months, and we can see the thick, good quality bands of the elastic tissue network here. Another one, 45-year-old woman who'd started out with fairly low levels and increased remarkably. The follow-up slide here is a bit dark, but again, it's quite clear here that we have the improvement in quality, not just quantity, of the elastin fibers. The next individual was a 46-year-old woman, and we see she'd started at 8.1%, gone up to 20.2% by the image analysis. The next one, a 60-year-old woman who has a little bit of fragmentation at that initial one. 11.1% was the actual percentage, and you can see the much better quality, much denser, better fibers, as well as the increase in quantity to 20% by 2 months. The next individual, a male, 44 years old, going from 6.2 to 17.7. And I think what's noteworthy as we go through each of these cases, we see increases. And the increases really to the range in the 15% plus and getting to levels and quality that we see in youth. The next case, a 50-year-old woman, limited elastin at 6.3%, going up to 26%. We see denser bundles of elastic tissue as well as the increase in quality. A 40-year-old woman, despite being at the minimum age for the study, a very low level of elastic tissue at only 4% at baseline, quite wrinkled for her age. By 2 months, though, it had tripled to 12.1%. In summary, then, what we had with the second study is that the 0.5% followed by the 0.01% in the moisturizing base was quite effective. In fact, it was as effective as the 5% had been. Therefore, we feel that we were blocking the receptors for the DHT adequately. We showed significant improvement on image analysis as early as 1 month, with increases of about 50% over the baseline in the elastic tissue level. At 2 months, we had reached the levels that we found in the youthful population that showed the controlled slides. And clinical improvement was documented at a p-value of less than 0.001, which is highly statistically significant.